So thank you, first of all, for being here, as I'm the last speaker, I think, of today and of the conference. My name is Serwet Demirdas. I'm a clinical geneticist in the Netherlands, in Rotterdam to be precise. And today I wanted to talk to you about inclusivity for EDS in scientific research. Yeah. Oh, I see one slide is missing. So I think it's first important to talk about why we do research. If we look at rare diseases, we see that there are many people who have experienced particular obstacles in accessing high-quality healthcare. So what we see also in rare diseases, and therefore in EDS, is that we still have certain problems when it comes to good healthcare. There's a lack of scientific knowledge about EDS, and I think that's for all types of EDS. There are still delays in diagnosis, which can go up to decades, as we know. There's a lack of an appropriate multidisciplinary healthcare system, and we see, therefore, in our patients that there is a dissatisfaction and loss of confidence in medical and social services. And we can understand that even better when we know that sometimes even healthcare professionals can deny treatments to patients. And I think also very important, we still have a lack of availability of a cure for for EDS as a whole, sorry, not just HEDS. So this is why we do research, scientific research. We want to get a better healthcare system and better treatments for those with EDS. Today I'm talking about those groups or individuals within the EDS community who we cannot reach easily. So we're talking about marginalization. And marginalization basically means that there are people being left out. And we have to think as researchers about who we are leaving out of our research. There are certain groups that we have to think about to add to, as participants to our studies, to be able to give a very large answers for the questions that we have when it comes to what EDS is and how we can treat it better. Because you want to give these answers, not just for certain groups within the EDS community, but preferably for all those suffering from EDS. Here I have listed a few groups or few groups that we have to think about. So for example, socioeconomic factors can play a role in when we look at marginalization. We know that those with a higher income and also those with a higher education more easily find their way into the healthcare system, and therefore also more easily to academic research. We know that there may be differences in how a disease presents itself if we look at differences in sex. So biological women versus biological females. For example, in HEDS, we see that far more women have complaints than men. So when you do research in that type of EDS, you have to be aware that if you also want to talk about differences between these sexes, is that you have enough men that you look at. The third group that's important to think about are ethnic minorities. We also know from a healthcare perspective, and we know from scientific research, that unfortunately within countries, ethnic minorities are less often referred, unfortunately, less often diagnosed and less often come into contact with researchers. But we also know that you have to think about whether or not a disease acts the same in all peoples. So this is very important. And I think from a rare disease perspective, also EDS perspective, research is being conducted mostly within the Western world. So there is a shift in, I think, those communities with EDS that we look at, and we have to be aware of this. As I named, There's also a healthcare system problem. It's quite complex. It's not really in place, except for some centers within the world. But overall, there's a lot of loss to follow up for patients, or there are a lot of people not recognized. So you can imagine, for this reason, that we are missing patients within the EDS community that could have been added to our studies as participants. We also know that funding plays a role. So sometimes you can even talk about marginalized groups within EDS as the whole EDS community, because if you don't have funding, you can't do research. And we also know that there is not enough research, not enough funding, but also not enough researchers, and I think those two are connected. So that's what marginalization is, leaving people out, not getting the results that you should be getting. But why is it important? Why should we be inclusive? I think the most important thing is that we want to know what the needs of everyone with EDS are. If we know this, we can do a participatory research approach, and we can find our stakeholders. If we know where stakeholders are, we also know that these patients are experts in their own disease, and we should have their input. So then we also know which groups within the EDS community may have different outcomes and may need another type of healthcare. Basically, you want to look at all unique experiences and needs of the patients. So if you have a broad inclusion within the EDS community, you can expand your reach, but also your impact. It's also important for us to know, as researchers, what we're talking about, because we advocate for our patients. It's a rare disease. People look at us for answers. So if we're answering, we should be answering for a broad community and not just for specific groups with EDS. So we know why it's important to get a broad perspective, but what are the barriers that we're looking at when trying to get a broad perspective? So if we want to identify barriers, we have to acknowledge that there's a lack of awareness of EDS, not just in the healthcare professionals, but also in patients themselves. We know that there are geographical barriers. These can be within the country, people that cannot easily come towards the healthcare system because, for example, they live in rural areas, or just due to borders. Especially for the very rare types of disease, you need to cross borders in order to do inclusive research and to come to the numbers that you need to make actual conclusions. There might be economic constraints for patients to actually participate in research. And examples could be cost for travel that they would have to participate, or also the need to take time off work to participate. And unfortunately, we know that there is a distrust of medical institutions, which might also lead to people not wanting to participate. So we need to address these barriers. We need to increase awareness. We need to enhance accessibility to the research facilities. We need to provide support. We need to build trust. By addressing these barriers, we can make EDS research more inclusive and ensure that the findings are more representative and beneficial for the EDS community as a whole. Okay, now we know what the barriers are, but what can we do? What strategies can we use to increase engagement and inclusion? First of all, targeted outreach and education is important. And education can, for example, be through informative information dissemination. And I think the EDS Society does that very broadly, and I think their efforts are seen worldwide. Accessibility. What we can do within our protocols for research, we can think about accessibility, try to adapt our protocols to make sure that those with physical limitations perhaps can participate remotely, or maybe even we can go to them instead of them coming to us. And we can also, of course, think about logistical support. So if you have to take work off on Monday, maybe you can come in on Wednesday. And financially, of course, until, to a point, we can also help. And what we can do is give travel reimbursement, for example. Then for people to want to participate, they need to trust you. So we have to build trust. We have to be transparent in our communication towards our patients, and we also have to talk to patient advocacy groups. It's important to have those contacts from day one when you start thinking about developing your protocols, and to keep them also participating and in communication with you during the study. So these are some strategies we can use to increase inclusivity, but we also need capacity to make sure that we, through the whole process, can remain inclusive. And capacity building, you need also some funding for that, which we already discussed is not always easy, but when that's there, you can train your researchers. So you can train them in cultural competency so that they know how to talk to people, which is quite important if you want to, first of all, include persons in your research. And secondly, of course, also important if you want to build trust. And you have to make sure that everybody who is within your research team is conducting the research under good ethical considerations. Capacity building can also be done through collaboration. And I think especially for EDS, as it is a rare disease, we need to do this internationally. We can work together with physicians who are closer to those patients that we want to do the research for and on. And we can work with international registries and also biobanks. So registries where the physicians can enter the data of the patients, and the biobanks, so we can have samples of these rare patients to use for future research. Then, of course, we need to empower our participants. We need to take them within the research process. They have to know what they are saying yes to, and they have to know their rights. So then we get to ethical considerations, because what are the... Oh, okay, I got distracted. Is this from outside or? Ah, okay, thank you. So I can go on. So I want to talk to you, what are those ethical considerations? Because we are talking about empowering the participants. We need informed consent, of course. And informed consent is basically making sure that those participating in the studies understand fully what they are saying yes to, and that they understand their role within also the research that's being done. And here I also think it's important, if we're talking about respect and autonomy, to make clear to those participating that throughout the whole process, they also control what's happening to them. They can say no, and also they can stop if they would want. These are important things to think about when you are asking patients to participate. What's also important is that when we have our outcomes, that we share them with those participating. Not just with those participating, but with the patient community as a whole. And there again, I think the patient advocacy group can play a good role. For example, for vascular EDS, what we did when we had our cohort study, in the ending, we of course published the results in a peer-reviewed paper. So in that way, we shared it with our colleagues, and we are now discussing if for the Netherlands, we should change some policies in healthcare. But for the patients, we did a patient day together with the patient advocacy groups, and there we shared what we found. We also had some specialists coming in and telling a little bit about their specialty when it comes to VEDS, and patients were able to also ask questions. Okay, so you've thought about how to be inclusive, you've made your research protocols based on that, you have informed the participants, you are working together with patient advocacy groups, but you need to also keep evaluating the impact that you're having. So you need to do a continuous assessment. And I think one of the best ways to do that is to ask feedback from, of course, the patient advocacy groups that you're working with, but also the participants. But when you get the feedback, you should also be open to adjusting your approaches. So if you feel that that there might be a way to better fit the needs of marginalized groups because you're not reaching them, for example, in the way that you thought you would, you should adjust. I have 2 more slides, and I basically want to talk a little bit more about the genetically identifiable types of EDS. To be inclusive for these types of EDS, we can use genetic testing. But as I said in the beginning, there might be some issues with those countries who do have genetic testings and those who do not. And those who do have experts who know a lot about specific diseases and those who do not. So we should think about making this more accessible throughout the world. And I think for expert evaluation, that's easier than for genetic testing. Experts throughout, for example, the consortium can be available for questions, but genetic testing, since it also costs extra money, is not always easy to provide for the whole world as such. What's also important to do for the very rare types of EDS, which might not be easily recognized, is to have targeted awareness campaigns. So target those specialists and other caregivers that you think will have contact with these types of patients and make sure what the disease is. I think also for multisystemic disease, it's quite important to have a multidisciplinary approach. We see for EDS that there are a lot of geneticists and rheumatologists doing research, but we need also the other disciplines to look into these patients. And as I said before, especially for the rarer types, it's very important to overcome geographical barriers, work together, use the registries. Then for HEDS, and I think that has been named, there's a diagnostic challenge. So we have to be careful when doing research into this type of EDS that we're looking at the correct patients. So we have to think about protocols for diagnosing HEDS correctly and make sure that we're not misdiagnosing. So not looking at patients with basically other problems than HEDS. Also, we know for HEDS there are a lot of problems with mobility and pain, as we just saw. And we have to think about remote participation options. So maybe go towards the patients or do telemonitoring, video calls, if that fits within your protocol, of course. And it's important to educate those with HEDS, but also the healthcare providers about what it is. And also, especially I think for this group, it's important to work on trust and transparency because there's a lot of mistrust in the medical community. So in conclusion, making EDS research inclusive is not just a noble goal, but it is a necessary one. And by identifying barriers, engaging with marginalized communities, building capacity, and conducting ethical research, we can ensure that all voices are heard and that our research truly serves those who need it most. Thank you.